Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Hi, I'm Beth Parker, and welcome to Ethical Perspectives on the News. A few weeks ago, we held an episode about civilization and civility. That is, we think of ourselves as being very sophisticated, advanced, and civilized. But yet, we are over-resourcing our environment. We are at war with ourselves and at war with each other. Why the discord? How have we lost essential connections? I'm reminded of the Buddhist monk who visited the hot dog vendor and said, "Make me one with everything." Well, could it be a matter of discovering our inherent and collective connections? Are the answers right before our eyes? On the horizon, and in fact, in practice, comes research and discovery concerning potential healing therapies. Let's ask our panelists to introduce themselves and provide an introduction to their work. Chris, you want to start? You've been through this before.
Yeah, sure. Thank you, Beth. I appreciate the opportunity. My name is Dr. Chris Parker. I'm a clinical pharmacist. My background primarily is in the management of chronic conditions for patients struggling with a wide variety of chronic conditions, from diabetes, high blood pressure, heart failure, to a wide range of psychiatric issues as well. So I appreciate the opportunity to talk about this topic, an important area of interest.
Hi, I'm Shannon Myers. I am a trauma-informed certified integrative medicine for mental health provider, and I am a MAPS-approved psychedelic integration professional. I'm a big proponent of root cause healing, mind, body, spirit, energy. I have a virtual and private practice, and I am also a professor and visiting professor teaching about root cause integrative medicine and psychedelics.
So each of you, from your perspective, why this sudden rebirth of interest in psychedelic therapy?
I think it's more part of the social conversation right now, right? Like you said you were reading Michael Pollan's book. This is Your Mind on Plants. There's The Immortality Key, which is a wonderful book. There's more social interest with podcasts. More individuals have told their stories of psychedelic healing. And this converges with the decriminalization movement that is happening in the United States, and internationally in other parts of the world. We have ketamine-assisted clinics as well now. MAPS moved to more research, and so they are proving a lot of research. There's university studies all over the country that have psychedelic labs and that are proving out the research. And then the VA is doing a ton of research. And so it's here. Psychedelics never went away. They just went underground. And so now we have the research to prove that, hey, they work for certain conditions with certain folks. And I'm excited to talk about that tonight.
Yeah, and I would say, Shannon really hit on the fact that this topic has come up more specifically on social media, the podcast movement, and people have more access to information than they ever have in the past. There's also many patients who failed other therapeutic options that are looking for alternatives. And so when they get access to this information, they start questioning it, they start reaching out, they start learning more about it, educating themselves on what's available. And so as they start to demand alternative therapies, that brings it more to the forefront for us as clinicians to consider and as legislators to consider what is available, what's safe, what's effective, and how can we implement this in a safe and effective manner.
Mm-hmm. And please, you two, feel free to discuss or bring up points that
I love that point. I'm more in the alternative health, world, but we're also really evidence-based. I'm double board certified, and I see folks that have tried everything. They've tried everything, and they're labeled treatment resistant, but they try psychedelics, and maybe they go overseas or wherever. And you see health conditions start to improve. You see mental health conditions start to improve. serious levels of trauma start to improve. And folks are sick of feeling sick. There's a big, strong movement that's being led by the people because they want to heal. They're sick of suffering. We have the highest rate of mental health conditions and trauma and physical health conditions that we've ever seen, especially with this ongoing pandemic. And it's not going to stop. This is going to ripple out for generations. This is going to be this collective trauma that we've experienced is compounding the mental health and the physical health conditions, since they're bidirectional through your nervous system. And so folks are demanding more care, and they're demanding to have cultural competence, trauma-informed care, medicines of their ancestors. I'm a person where I can't take certain pharmaceutical medications for my mental health. Genetically, it doesn't work. I've had genetic panels and those types of things. And so there's a lot of folks like me that have a lot of knowledge about their health. They've tried everything, and they are on the verge, and they will try anything. And so there's so many people that are listening to podcasts and books, and they're getting curious about what else is available for them.
Yeah, and I think the challenge as clinicians that we have, Beth, is that the information coming to these patients and the information that they're gathering, how do they weed through it and find what's accurate, what's safe, what's effective, and what specifically pertains to them? Mm-hmm. And that's a challenge that, for me, I enjoy because it keeps me on my toes to know what I should be considering. I remember when a pharmacist that was working for me moved to the state of Colorado, and they were in the process of legalizing psilocybin. And we graduated in 2006. She called me and said, "We didn't talk about this in school. We better get brushed up on it." And she's right. A lot of that stuff was kept out of the mainstream education system because it was considered far too alternative medicine at the time and took on a bad connotation. And so it really forces us as clinicians to be aware and prepared to have these kind of discussions, because patients are coming at us with this kind of information and asking for more guidance. And we better be ready to provide it for them.
Mm-hmm. Absolutely. Part of my work as an integration professional is actually on the front side. And so I have extensive training as to which mental health state and which plant medicine or psychedelic matches up, because you want to match your mental health to the state, in addition to all levels of reducing harm, setting intention, where you're doing the medicine and who you're doing it with. There's a ton of considerations that we have to make. What is your trauma history? What is your cultural conditioning? What is your religious background? What things could potentially come up, and really putting some sacredness back into these medicines. Because it's very serious. I mean, I'll sometimes we'll call this soul work, because it can be that transcendental of an experience, where I'm making sure that people are really, really prepared for this. Because sometimes they'll hear, well, this person, they're getting on these like Facebook chat groups or social media chat groups, and they'll say, well, this person tried this medicine and they feel a lot better, but you don't understand what that person's mental health baseline is. And it's not the same as yours, nor is your trauma history, nor is your genetics. And so we have to really, as clinicians, discern genetics even as well, because it's an out of body experience at higher dosages. And we want to be reduce as much harm as possible in all of the different realms, physically, environmentally, medication wise, because there's some health conditions and there's some medications with certain plant medicines or psychedelics that do not go together.
And so what comes to my mind, and both of you weigh in on this, Chris, I think you were, I hope that I'm in concert with what you were saying. The challenge is educating people and helping people feel safe, practically, but also legally.
Yeah.
How does that work?
And that's a huge challenge, Beth, because right now, while there is some decriminalization of some of these products, you have to know from a compliance perspective what you have access to legally. And we here in Iowa know, with the issue of cannabinoids, when for the longest time they were not legal in the state of Iowa, but people were driving to Colorado, crossing the state of Nebraska, picking up their cannabinoids, driving back across the state of Nebraska into the state of Iowa. Well, that's a federal crime because you brought an illegal substance across state lines. So educating people who are maybe at wit's end. In some cases, we've heard the stories about kids with epilepsy and seizure, and the only way that they could treat them was with these tinctures from Colorado. I get that, and I'm very compassionate to that. But we still have to work within the realms of the legal system to understand, okay, let's figure out how best for you to do this, and then not put yourself in more of a state of harm because of what the current laws and regulations are. So certainly some logistical items that had to be thought out through that process.
And it's important to distinguish, this is not like a recreational drug use at all, correct? I mean, we need to make that distinction that it's.
Yeah.
People are still going to do what they're going to do, right? Though, I mean, you've seen it.
Yeah.
And so both him and I were having to toe that line between here's the costs and benefits of that, right? Like this is a felony if you're doing that, and we have to educate on that, because both of us, because we're licensed clinicians, I can't refer someone, even though it's happening underground. I can't refer someone underground because sometimes folks are over the weekend, I get so many emails to the point where I don't even know if I can get back to them, because there's so many people going on maps and thinking that I'm like a sitter or a guide, or that they're going to do magic mushrooms in my office. And we still have to follow the legality in Iowa as well, because this is where we're licensed, and this is where we're working, and this is where this person that is seeking this lives as well. And so they have to follow the legalities in Iowa as well.
And I think the other challenge from situations I've heard from patients and colleagues of mine, where you'll have somebody who heard from a friend that they did a psilocybin treatment program, but then because resources are limited for this other patient, they don't have access to that clinic, right? So then they find somewhere access to mushrooms, whatever that may be, and then have this opinion that should take care of their problem. So they're not monitored, they're not overseen through a legitimized program, and then they go through this quote unquote treatment that may or may not help them, and in some cases actually cause harm. And I'm not trying to compare this to, say, the fentanyl issue now, but look at where we have people who, from an opioid crisis, are now trying to get to fentanyl that's laced with other products and in turn killing themselves. So if we could put this in organized programs that are sanctioned and overseen by healthcare professionals to help patients do this correctly, then that's going to lead to future uptake at a higher level, because you're going to see more success rates and fewer failures, I believe.
And that's a hard part about the plant medicines being criminalized, right? So let's take alcohol, for example. We have had alcohol here for a long time. And so even with youth, someone who shouldn't be accessing alcohol at like age 18, we can still treat or talk about responsible drinking, even though someone maybe shouldn't be using that. I operate from a harm reduction model, meaning like harm reduction means drugs are a part of life, and folks are going to do what they're going to do anyway. And so coming at it from a trauma-informed harm reduction lens is making sure that folks minimize the risk. And so to Chris's point, talking about you need to be testing things that if you're getting things, making sure, because things are being laced with different substances. And I am very, very serious. Not all psychedelics are for all people. I mean, with certain health conditions or with certain mental health states or predispositions to, it can be disastrous. And so we want to make sure that we're really, really mindful about what is going on and how everything kind of comes together, because folks are getting very, very desperate, because I mean, I have never experienced the rates of trauma and mental health as they are right now. And I can't even articulate just the rate of despair, diseases of despair right now, folks that are just I mean, I'm picking up the phone on Monday morning and they're like, I'm either talking to you or I'm killing myself, because I am done. I am done. There's nothing left. I have no hope. I've tried it all. And so we need to decriminalize these substances as well, because to Chris's point, even access is a huge issue right now. We've got ketamine clinics that it's costing folks, maybe it's like $700 for one treatment, and they're not even getting the therapy to go along with it. And so there's a huge access issue. There's going to continue to be a huge access issue. And so the more that we can, it has to happen at all different levels. The decriminalization has to come with drug treatment. It has to come with healthcare funding intervention. It has to come with building a bridge to Indigenous communities and bringing the sacred back, even into ketamine clinics to clear the space and things like that. But that's not being done. Mm-hmm. So some of the outcomes are low right now because we're getting it wrong. In the places where we are even doing psychedelic therapy, it's not being done in a trauma-informed, culturally competent way.
So how does all this come together? How do we move legislation forward? How do we design or develop or even consider legislation? Can you both talk about that a little and what needs to be done? I can't believe that there aren't people listening who I want to know more about this.
Yeah. So, and I guess I would start, and Shannon, please jump in here if you have some more background than I do in this area. But one of the things that I would do is model other programs that have been effective across other state lines and in other countries. So we know, for example, there are clinics down in Mexico where patients are leaving across the country line. They're going down, doing some of these clinics in Mexico with high levels of success rates. And many of these clinics in Mexico are being run by physicians trained in the United States. And they're going down there because they know that they can offer these services and do it in a way that it's legal in Mexico, but not the United States. So one, I would model the safe and effective programs that are currently in place. Two, we have existing models of doing this for other programs, whether it was opioid reduction, and that's a whole different topic, but opioid reduction therapy. So we've done that. We have clinics in place. The problem is, and I have a neighbor who's a family practice physician who would love to get into this area, but it's the regulations around being certified to do that. So the cost for him as a clinician to get certified to administer some of these programs, and then the liability insurance that he has to carry on top of that, are more than he's willing to facilitate, because it's a risk-benefit ratio even at the provider level. So again, some of those other barriers that have to come from a legislative, and it's a balance of what restrictions should be and regulations should be in place and what regulations maybe need to be loosened to administer it effectively.
Yeah, absolutely. There are some really great best practices even in the United States. Like there's a training facility, IPI in Boulder, that's doing amazing work there. Even Ann Arbor decriminalized, and I like a lot of aspects of what they did there. Again, the things that I keep seeing missed are the drug treatment, and then involving healthcare funders as well. Like Medicaid needs to be involved, Medicare needs to be involved, insurance funders need to be involved. So this isn't facilitated as like, well, you've failed everything, and now this is what you tried. This should be able to be frontlined if it aligns with someone's informed consent and voice and choice, and it's a trauma-informed model. Last year, we had the opportunity to decriminalize psilocybin, and a lot of folks wrote in, and I was at the State House speaking on behalf of the work that I'm doing, but nobody really came out. One, it was during the middle of the pandemic. It was very early in the morning, and a lot of times, because of this is illegal, folks don't want to risk their social social like isolation from like coming out of the psychedelic closet. They're worried about their jobs. And so people felt safer to write in, and there needs to kind of be a shakeup on the health and safety committee, because there's someone that is, I would call them extremely not trauma informed, that is on that committee that they're looking to for leadership. And so we have to decriminalize psilocybin in Iowa. So it's psilocybin, magic mushrooms have been written into our state code as, a category where it's prison time. And so we have to take that, we have to rewrite the Iowa code. And so what you can do is start to write your legislator. You can go and look up who my legislator is. And just, you can say, I'm a concerned citizen. You don't have to disclose any, you don't have to say that you've used psychedelics. You could just say, I would like to have all options on the table as far as for mental health or trauma, and decriminalize psychedelics. The other thing that we can do too is, it looks like psilocybin is going to follow cannabis. If you're following this, like as long as I have been following it, so you can go on to normal NORML. Right now we have the historic MORE Act. Right now it's sitting in the House and it's moving on to the Senate. And so you can go and write your legislator from there just by clicking on a button, because psilocybin in plant medicine is going to follow cannabis. And so I'm so hopeful because of what I see cannabis happening, what happens with cannabis, because it's bipartisan support that is happening. Folks from every single walk of life that I'm working with are pro-cannabis, Democrat, Republican. Maybe they don't vote at all. Maybe they're independent. Maybe they're from a third party. And so they're all proponents of it. So it's amazing to see all the different backgrounds that come to plant medicine and psychedelics. And so I'm still very hopeful.
Christy, were you adding something or?
I was going to. I guess the only other thing I would say, and I remember being taught this back in 2002 in pharmacy school, some of the most effective, and I've seen it replicated many times, some of the most effective ways to get legislative action accomplished is to find someone in a position of power, specifically in the legislature, that is personally impacted by this. I think of the Medicaid program covering all kidney transplant patients after they had a transplant. That occurred because someone in the federal government had a daughter who had to have a kidney transplant and they couldn't afford it. And so what did they do? They wrote into legislation that all patients who had to go through a kidney transplant could then be automatically covered through Medicaid program. So great, there's a great example of how to do that. Now, in today's world, the discussion of psychiatric disorders is at the highest socially that I've ever seen. I've been practicing for almost 18 years. And people are talking about their concerns more and more. So if you, to Shannon's point, can find your legislator and see if they or anybody in the Iowa legislature specifically is talking about their battle or a family member's battle with a psychiatric disorder, getting them one-on-one or personally going at those heartstrings of, here's something that may help you or your loved one that maybe you hadn't thought about, or you've tried everything else, but you need to consider this in more depth. So a little bit of pulling at those heartstrings to get that effect.
That makes a lot of sense. And I was just referring to the book by Michael Pollan about how to change your mind. And what hit home with me was a very specific incident he refers to about a patient who had terminal cancer, who was terrified of dying. And whatever the procedure was, whatever the therapy was, ketamine perhaps, he underwent the process. And he lived, 17 months after his psilocybin, and I'm quoting from the book now, after his psilocybin session, according to his wife. And the last months were filled with great unexpected satisfactions. Then I just want to go over this paragraph quickly. That fall, his lungs began to fail, and Patrick wound up in the hospital. He gathered everyone together, said goodbye, and explained that this was how he wanted to die. He had very constant death. His seeming equanimity in the face of death exerted a powerful influence around him. His wife said, she talks about how the nurses and the doctors wanted to out his
conditions resolved after plant medicine. I love that you shared that story, because there's also use case scenarios for dying with dignity. Right now, again, I pushed the Health and Safety Committee on this, and they said, well, we have pharmaceutical drugs that
not the same, right?
They're not the same, because they block DMT from being produced, and DMT is how our soul goes back home. And so I'm very concerned about the pharmaceutical measures, because I have folks contacting me on their last couple of days here on Earth to move out of state to die. And I think that is the most tragic and sad thing that we can do for an Iowan that's been here for their whole life, to have to leave the state to die how they want. It's tragic.
You know, this
And Beth, I
conversation.
guess the last thing I would add. Go ahead.
I was just going to say, as the conversation gets good, we start to slowly run out of time. What would you like for our listening audience to take away?
Well, then I'll tie this into my last comment then. I appreciate everything that we've discussed today because it is an important topic. One, don't be afraid of something you're not familiar with. Many folks are not familiar with this process of the use of psychedelics, and it's been given a bad rap and it's been put in a negative light. So don't be afraid of it. Two, you have to remember that our current available therapies aren't effective for everybody. And so to say that, well, we have these available therapies out there, yes, that's true, but other people aren't always getting the same benefit from it. So that's something else I would consider. And then three, allow yourself to be challenged to alternative options that maybe you haven't come to know and understand, but have an open mind enough to allow others to consider that option for their well-being.
Shannon, can you take a few minutes and now?
Yeah, all psychedelics do is open you up to a larger state of consciousness. We are, for those that are breathing right now, congratulations. Breath is a psychedelic. Those that have coffee in the morning, that changes your consciousness. Those that smell a sweet scent of lavender, that also changes your consciousness. So we have to really investigate the roots of our internal stories about the war on drugs. The war on drugs was manufactured by the Nixon administration to imprison Black, people of color, disabled folks, and to promote a for-profit school to prison pipeline. This is widely known. So we need to reauthor our human story to not be at war with our nature and with ourselves. And the war on drugs really is a war on trauma. And the rates of mental health and trauma have never been higher. So lean in with curiosity and compassion to consider alternative therapies. And that'll open doors for people. Listen to people's stories. If you go on the internet and just read stories about healing, this can be a profound shift in your consciousness as to, wow, I had never known. So the more that you feel safe to share your stories, Iowan, as much as you can come out of the psychedelic closet, I dare you to be courageous enough to do so, because you might be someone's medicine.
So we really do have to close here, and I'm sure that there's much more that we could talk about. I want to ask if we could imagine a world in which we learn to manage addiction, learn to understand rather than fear death, and a world in which Vladimir Putin and Joe Biden could consider each other's positions and maybe resolve their differences. I want to thank our guests, and we will carry this conversation on. Thank you so much.
Thank you, Beth.
Thank you.